Hi, Dr. Osborne here with Gluten Free Society. I wanted to talk a little bit today about osteoporosis and gluten sensitivity. It's a well-known, established medical fact that gluten can induce bone loss. But what happens is most patients, when they get this diagnosis of bone loss or osteoporosis, their doctor tells them to take high doses of calcium and vitamin D and kind of leaves it at that, aside from maybe prescribing a bisphosphonate or other type of medication. Well, a recent research study discovered that people with gluten sensitivity actually can create an autoimmune reaction against proteins that help to build the bone. So in light of these new findings, what you should be aware of is that if you cheat with gluten, if you get gluten secondary exposure, this actually can perpetuate bone loss no matter how much calcium or vitamin D that you take. The other component that you want to gather is that taking high doses of calcium and vitamin D are not really the solution for bone loss. Remember that bone is a very complex tissue made of multiple minerals and produced as a result of the interactions of a number of biochemical ingredients such as vitamins and other food components. So eating the wrong foods can create or stimulate inflammation that lead to degradation in bone tissue. Eating the right foods can supply the right types of nutrients that help and aid in building bone tissue. And if you're going to blindly supplement with calcium and vitamin D, remember that high doses of these nutrients, when they're not necessary or needed, can actually contribute to imbalances in vitamin and mineral status that can contribute to bone loss, or that can contribute to kind of a bone structure that is less strong, if you will. One of the things I would recommend that you do if you've been diagnosed with premature bone loss, osteopenia, or osteoporosis is have your doctor do a thorough workup on your nutritional status. Now, one of the best ways to do this is using a laboratory test called SpectraCell, and you can get more information about them on their website or on our website here at Gluten Free Society. But this lab test identifies your body's long-term storage of vitamin and mineral status, including calcium, including magnesium, zinc, selenium, chromium, copper, manganese, and other important bone-building nutrients. In this way, you have an assessment of what your body actually needs versus just guessing and taking high doses of calcium and vitamin D, which again could potentially be a problem. So I hope this information was helpful. If you aren't signed up for our free newsletter, just click down below and put in your email and your name and sign up for our free newsletter, and we'll see you on the next time.